Okay, the recording is on. All right, and we are now at 2 o'clock. So I'm gonna go ahead and open the broadcast. Best of luck, everyone. I know it's gonna go really, really well. And again, thank you for doing this for us here today. Melissa, I'm gonna give it about a count to 5, and then you can go ahead and do that initial greeting.
Okay. Good afternoon, everyone. Our webinar will begin in just a minute as we get everyone into the room. Good afternoon. My name is Melissa Bertolo, and on behalf of Welcoming America, I would like to welcome you to today's member-only webinar titled Language Access and Communication Strategies in a Time of Crisis. At Welcoming America, we provide you, our members, with content and information that supports the work you are doing within your community, and our webinars are just one way to do that. To access past webinars and other resources, please go to welcomingamerica.org/learn/resources. From there, you can search by type, topic, and keyword to find the resources you need. On the next slide, we have some information to share with you about the rapid response work that we are doing around COVID-19. So we have some continuing webinars that are ongoing. The next one is on April 23rd. About focus on the topic of xenophobia and how to address hate and division during this time. Next week, we're going to be sharing some details around some really exciting resources and tools, including a community of practice for network members to engage around inclusive emergency management, as well as some language access coaching. That's actually going to be conducted by our presenter today, Jayne McCullough. And in May, we'll be hosting 2 global discussions for members across the world to connect and share how they're responding and be able to share those best practices with each other. So from Australia to Mexico to Canada to Germany, we hope you'll be able to participate. And then we also have some funding opportunities for members to access and support local community needs in responding to COVID-19. So we'll have some direct funding available to all of you in your work. And then we're also working with Vera on a brief about how to increase access to justice for immigrants during this time. So if you have any questions during today's presentation, please enter them into the chat feature on your screen, and we'll make every effort to answer all of those questions. Our webinar today will also be recorded and sent out to you after the presentation. So on the next slide, I'd like to introduce our speakers today. So first, Jayne McCullough. She's the Executive Director of Global Wordsmiths. And after she presents, we're going to have a roundtable discussion with welcoming network members, including Trujillo, who's the Director of the City of Portland's Office of Economic Opportunity, with DeLeon, who's the Director of One Siouxland from Sioux City, Iowa. And then we also have 2 members from Project Fine in Winona, Minnesota. We have Fatima, who is the Executive Director, and Katie Van Eijl, who's the Program Manager there. So Mary Jayne McCullough, who's going to be kicking it off for us today, she's the founder and director of Global Wordsmiths, which is a social enterprise that focuses on reducing language access barriers. And Global Wordsmiths recognizes language access as a human right. Mary Jayne is an adjunct faculty lecturer of global communication and applied translation at Carnegie Mellon University and co-chair of the Pennsylvania Immigration and Citizenship Coalition Board of Directors. She studied public service at the University of Pittsburgh and language translation and interpretation at the Universidad Autónoma Nacional de Mexico in Mexico City, and brings 15 years of field experience as a Spanish language translator, simultaneous interpreter, and language service industry executive to her current position at Global Wordsmiths. So at this time, I'd like to turn things over to Mary Jayne to start today's presentation.
Thanks so much, Melissa, and thank you all for attending. There's no possible way we can get through everything there is to know and say about language accessibility in a crisis situation. So this presentation is just going to make up one small portion of a bigger picture, and please do enter any questions that you have while I'm speaking into your chat feature. And as Melissa said, we will do our best to address them all during the Q&A portion at the end of this webinar. So, you know, I wanted to kind of, oh, I'm sorry, next slide, please. I wanted to talk about just the purpose and objectives of my training. We're going to be talking to you all just to give you some tools and information you can use to improve your communication with English learners in your communities during this COVID-19 pandemic. The main topics we're going to go over are going to include where to even start, right, with dealing with this, and how to centralize the information and sources that you're identifying. And then identifying and streamlining vital information for fast delivery, and using machine translation effectively in a crisis situation, as well as effective language access advocacy strategies. And we'll talk more about what all of that means as we move through this presentation. But before we do that, I think it's really important to acknowledge that there's no playbook for this. There's no baseline to compare any of this to. There's no expertise out there that can guide us through a situation like this, because nobody has ever been through anything like this before in our lifetimes. And just because there is so little experience and no previous situation to compare this to, we really can't get much feedback, or we don't have much feedback that can help us to improve, right? So we're all in survival mode, and with regard to language access, it's literally about survival. So I just want to preface this by saying, do your best, just do your best. And I think that providing language access services can be intimidating enough, and it's very easy to fall into a trap of like becoming paralyzed by just the anxiety about getting it wrong. But just by being here today, you're a lot further down the path than many organizations, governments, and advocates are. And, rather than focusing on, what we're doing wrong with regard to this topic, let's just all acknowledge that we are learning together, and that's a really positive place to start this discussion, right? So where do we start? Can you add next slide, please? So to design effective communication strategies in the time of COVID-19, responders need to first understand what the demographics are and what the needs are in their respective communities, right? So, what are the language groups in your community? And I think most of us as members of this organization work regularly with or are familiar with the communities in our geographical regions. But, dig a little bit deeper than that, right? You don't want to just kind of say, right, the top 5 languages in my city are, Arabic, Swahili, Chinese, Spanish, in our case, Nepali. You want to dig deeper than that, and you want to talk about who speaks these languages, right? Who speaks Swahili, right? Is it all people from Kenya? Is it maybe people from DRC, right? Who are these communities? What are the different cultural groups that are represented within these language groups, and where are they geographically clustered in your area, right? In your city, in your county. And I think it's also really important to keep in mind when you're identifying these groups, age, literacy levels that may present complications, and any particular challenges or cultural considerations that those groups might have, right? And you can kind of start to form a map of people and of their needs and of their language groups in this way that's not just kind of arbitrary, right? It's not just, you know, Spanish speakers live in this neighborhood and that's it, right? Because sometimes we'll learn a little bit later, you might need to use other mediums, right? And you might need to deploy text messages or visual aids or video materials for people who may not have the same level of literacy as other language groups, for example. And so in that same respect, you want to also think about any additional needs and barriers that these communities might have. So, you know, when you're thinking about these communities and you're painting a picture of who needs information and in what language, why, and what some external factors, needs, and barriers might be, it's also kind of important to think about who leaders are within these communities and engage them in this process. Right? Do they themselves, priests, advocates, activists, leaders within these communities, do they themselves have like a fact-based current grasp of the information? It's changing so rapidly and it's all subject to rumors. There are a lot of pervasive rumors and disinformation that they might be accidentally spreading, right? And that goes for English-speaking communities as well as English learning communities. So, you know, find out when you are identifying these groups and their leaders, what sources are they getting their information from, and how can we streamline information from more reliable sources, right? To make sure that everybody's getting the same information and that that information is correct. Okay, next slide. So, you know, to that effect, responders, you know, that would be us, service providers, need to have reliable, consistent, and streamlined information that we can share with these groups and we can share with these leaders, right? Because, you know, I know at least in Pittsburgh, where my organization is, we've got tons of really well-meaning social justice initiatives and advocacy groups and government agencies all spreading different information. And even in that case, you know, most of the information is correct as far as we can tell, but there's so much of it coming from so many different sources that you want to try to pare it down, and along with the other stakeholders in your communities, identify one or maybe two sources and have them be the same sources that everyone is drawing from, right? And I know in smaller cities like Pittsburgh, it's easy for us to do that because stakeholders all know each other and we all talk regularly and we all work together. So we can say, you know what? To shut out some of the background noise, we're all going to use the information supplied to us by the Allegheny County Department of Human Services at this time, right? Because we know it's reliable, we know it's fact-based, it's current, it's changing every day, and also it's not conflicting or being confused with information that might be coming from our city or that might be coming from an advocacy organization. So essentially, we have our county sending us information every morning, right? And then we're able to get it translated as quickly as possible and then funnel all information from that source out to channels that can then take it into the communities they serve. And the channels are the stakeholders, right? They're the service providers, the nonprofits, the small government agencies, the advocacy groups. So once you've identified and kind of delegated sources to collect information from, you want to funnel all of that information from that one source through all of the stakeholders in your community, right? And then each stakeholder can work for the most effective dissemination of that information. And when we talk about effective dissemination, we mean rather than, you know, all the stakeholders sharing all the information with all of the English learning communities in their area, stakeholders would be distributing information to the communities with whom they work most closely, right? And in the case of the source of this information, in our case, the Allegheny County Department of Human Services, it's really helpful if there's a person who's sort of in charge of releasing that vital information, right? That way you have one sort of emanation point for the information, and things stay very clear and streamlined. Now, in bigger cities where it's not as possible to have that sort of, you know, perfect situation where everybody's cooperating and there's only one source of information, you know, there can still be just 2 or 3 sources, right? And everybody can be working very closely with the communities they serve. So if, for example, I use Allegheny County as our example a lot because we have a lot of different English learning groups in a relatively small geographical area. So there is a Bhutanese Community Association of Pittsburgh, and they obviously work directly with the Bhutanese Nepali communities. So, you know, BCAP, or the Bhutanese Community Association of Pittsburgh, is taking that information from that one source, from the point person in charge at that one source who's releasing this vital information, and they are sharing it directly with the Bhutanese Nepali community, as opposed to, you know, All for All or the Alliance for Refugees, Youth Support and Education, also sharing that same information with the Bhutanese Nepali community, right? So it's much less confusing that way, and everybody is able to kind of work in smaller chunks of information and work with smaller parts of the broader demographic, which makes things a lot easier to digest, right? It's not such an overwhelming problem if everybody is doing their small part. You know, sometimes that information is going to be ready available on county websites, etc. So there wouldn't be a reason to delegate a point person, but it's still good to know of somebody that you can reach out to for reliable information within whoever that delegated source organization is. But, you know, this source isn't necessarily going to be in charge of translating the material, right? And so that's the tricky part. You know, they're going to be giving you the reliable information, but then what do you do, right? Government, or some governments will do the translation, and that would eliminate most of the problem. But what's more likely is that you're going to have to work together as a community in, you know, some kind of scenario where maybe government issues the most accurate and up-to-date information, and then the stakeholders translate and distribute, right? So this is the scenario that I think is most common and that most of us will be in. So if you can go to the next slide, please, Anthony, we're going to talk about getting some of that information translated and some strategies for doing that. And the first thing you want to do is identify which information is considered vital, right? And which information can be passed over. Things are changing very quickly, so don't spend too much time on any one big piece of information. Like, for example, press releases. You know, they can be anywhere from like 600 to 1,200 words, which can take maybe 2 hours to translate. And by the time they get translated and then pushed out into communities, the information has changed and pivoted to something new. And press releases do have important vital information in them, but the entire press release might not have to be translated, right? So you can kind of pick out the important part or create a digest of all of the day's important information. You can ask your delegated community source to deliver the information to you in a digest format. Number of new cases, number of deaths, percentage increase since yesterday, for example. Very simple. And you can kind of put that into a template form and then just change the numbers every day. So the more simplified and sort of succinct the information can be, the better. Not just because it's quicker and easier to translate that, but also because it's easier to understand and digest, especially if you are, you know, maybe an English learning immigrant or refugee who does not come from a culture where there is the same level of, you know, culture around healthcare, right? Culture around hand washing, culture around hospitalization and health insurance and what all that means. And it can be very overwhelming. So keeping it short and simple, creating templates whenever you can, and plugging new information into it every day, that's going to save you a lot of work in the long run. Also, when we talk about identifying vital information versus non-vital information, you know, it can be a tricky call, but in general, you know, think about, you know, translating a love letter versus translating epilepsy medication instructions, right? Those are two totally separate needs. The latter obviously being vital information that needs to be translated by a professional. So identifying what information needs to be translated is kind of the first step. Creating as many templates as you can, getting that information as streamlined and simplified as possible is your first step. And from there, you want to identify and recruit what we call bilingual helpers. So bilingual helpers are people who are bilingual, fully bilingual. Please use native speakers or very advanced speakers, especially since we're dealing with health and safety information. But you want to identify and recruit these bilingual helpers who are bilingual but have not been through training to be translators or interpreters. They don't have any experience with training or with translating and interpreting necessarily, but they want to help and they have the language skills. Identify who those people are in your communities, and they can help verify the accuracy and correctness of the information that's being translated on a volunteer basis, or you can find language service providers, translation companies who are willing to help at a reduced rate or for free during the crisis situation. That's something that, you know, you'll never know unless you ask, right? Chances are a lot of the companies aren't going to be able to do that because small business is also struggling right now. But certainly if they can share resources, that makes everything a lot easier. But it's important to remember when you're identifying those bilingual helpers that being bilingual is not the same thing as being a translator. Oh, and I'm sorry, I've been using the acronym LSP. That's Language Service Provider. A language service provider being, you know, like a translation company or an interpretation company in your area. So, you know, once you've identified those people, just keep in mind that being bilingual doesn't necessarily mean that you're skilled enough to be a translator or that you've had training to be a translator or an interpreter. And, you know, the reason you want to do that is because you want to make sure that you're not just taking information and having an unqualified bilingual helper translating it and then sending it out, right? Because this is health and safety information. We're in a big hurry, we're in a big crunch, and it's scary and it's hard. But if you're not using trained translators, it's really important that you run it through at least two sources. And that can be a translator and then a bilingual, I'm sorry, it could be a bilingual helper and then a proofreader, or it can be tools that you can use to translate and then having a bilingual helper kind of go over the translation afterward. And what we call that is machine translation plus post editing. And that's something that's becoming more and more common in the language services industry. It is problematic, and that's kind of a topic for another time, but you know, these tools can be powerful and it's okay to use them as long as you're using them correctly and responsibly, right? And so what that means is that you're not just putting a Google Translate button on your website, for example. You want to make sure that if you're using machine translation, that you have these native level bilingual speakers proofread or post edit those machine translations, and that can save you a lot of time. And in a lot of cases, the accuracy is perfectly adequate for this situation, as long as you have that second set of eyes on it. Next slide, please. And so to that effect, talking about using machine translation, you know, this is something that's really controversial because machine translation is not reliable, right? Some of it's quite good. You know, if you're translating non-technical information from Spanish into English through Google Translate in particular, it might look pretty good. The problem is, unless somebody is combing it with a fine-tooth comb or making sure to go over it and truly proofread it, you never know what kinds of errors are going to be in there and what the consequences of those errors might be, right? And since it's not our job to decide what information is important, only to decide what only to, you know, do our jobs to make sure that it gets translated, it's important to not just run it through machine translation and call it a day. Because if it's used incorrectly, machine translation can totally alter the message and can cause dangerous results in the case of, social distancing and the consequences that are at stake. So, keep in mind that some of the pitfalls can include meaning that is totally lost just because of a lack of context. Machines can't recognize context. The quality of the translation completely depends on the language pair. So most machine translation is done via statistical data analysis, which is a fancy way of saying it takes all of the information that is out on the internet and it mashes it together and it uses statistical algorithms to choose the most likely pair whenever you put a query into it, right? And it's really good when there's a lot of information available on the internet, right? Such as in Spanish to English or English to Spanish. But when there's not as much information available for the statistical algorithms to choose from, then the output is going to be much less good, if you will. And so if you are, for example, using machine translation to translate Igbo to Vietnamese, there's probably almost no statistical information for that algorithm to draw from. And so the output is going to be totally useless. So you never know what the quality is going to be like depending on the language pair. And therefore, you just want to kind of treat all of it as if it's incorrect and take precautions. There are usually significant grammatical errors with machine translation also, and those can cause consequential miscommunication. And machine translation doesn't have any system for error recognition or correction. Kind of like Microsoft Word has the spell check feature. There's no way to do that with machine translation. So you need to have those post-editing, bilingual helpers, volunteers, or if possible, professional translators. But this would be, if you do not have access to fast, reliable, professional translators, I would recommend using machine translation plus bilingual post-editing, as opposed to just having inexperienced bilingual people do translations, because this provides two levels of oversight. And remember that there's a difference between life and death information and casual information also, right? So when you're using machine translation, obviously, if the messages do not go out in the street, somebody's going to drop a bomb there. You don't want to use machine translation to do that. But if the message is, hey, street party at 2 o'clock out, you can probably get away with doing machine translation there. But the problem is, like I said, it's not our job to decide what information is worthy of being effectively communicated. So we just want to make sure that even in this time of crisis, and even though things are changing really quickly, it's important to stick to some degree of protocol and control for errors by having your translations go through these two steps. Okay, next slide, please. So expediting your delivery obviously is really important during this time, because things are going so quickly, information is changing so quickly, and it's vital, right? It's literally life and death in some cases. The best thing you can do to keep information flowing quickly is to streamline it through that centralized source, right? Cut out as much of the background noise as possible. Identify sources within your local governments, wherever you can, and then a broad network can disseminate that information to kind of spread the labor out among multiple stakeholders. So in my city, for example, the Spanish-speaking communities all cluster, pretty close together geographically, and there are several organizations that work closely with those communities. And so those communities would be, the main people in charge of sharing information with them, but then BCAP would be the main organization sharing information with the Bhutanese Nepali community, and there is a Somali Bantu Community Association that would be disseminating, you know, our Swahili and Kizigua, you know, information. I'm sorry, my kids are knocking on my door. I have it locked so they can't get in. The more information you can streamline from that one point, the more expeditious the whole process will be. Identifying and recruiting those bilingual helpers into your communities as well. So we have identified and recruited those bilingual helpers to help with the actual translation and post-editing, but you also want to have some bilingual helpers on the ground in those communities who can help verify for accuracy and correctness on a volunteer basis, all of those language service providers. You want to also designate a responsible staff member within your organization, right? So if 9 different people are trying to do the right thing, right? They're trying to be helpful, but they might end up not being super efficient if they're both spinning their wheels for the same reason, right? So pick your point people and let them be the ones responsible for language accessibility while somebody else is responsible for the other stuff. And then finally, to deliver that information, it's really important to identify and nurture relationships within English learning communities with religious leaders, employers within the community, for example. I believe Erica will talk later about one of the big employers in her community and how effective they are at sharing information with their staff. Community activists and just various information. You know, you want to use those people as your point people to actually deliver the information. Next slide. Thank you. And finally, you know, again, this is a whole lot of information. It's just a fire hose of information, you know, shooting straight at you, and there's not enough time to possibly cover it all. So I've got about 5 minutes left here to talk, but I just, you know, I want to stress again that, you know, machine translation is not something that I would ever recommend using under normal circumstances, right? But we are in a situation where truly some information is better than no information at all. And so making sure that we're taking every possible step to make sure that it's done safely and ethically is very important. And just keep going back to that idea that there's no playbook for this. Just make sure that you're not just blindly putting stuff out there through machine translation, please, because that's always the worst. So the last thing I want to talk to you guys about is effective advocacy strategies, right? So all of us, everybody on this call understands why language access is so important, but a lot of the leaders and decision makers out there in our communities just don't have any experience with this stuff. So that doesn't necessarily mean that they're being malicious, but they might think that since they have the Google Translate widget on their website's homepage, that the problem is solved. So this combined with funding restraints and strained resources can mean that you might have to push harder to make sure English learners have access to health and safety information during this crisis. I personally spent the first half of my career advocating for language accessibility. My main technique for a really long time was to go into hospitals and yell at people, and that didn't work. So I've learned a few things about what does work and you know, how you can avoid alienating your local leadership. So these are just a few suggestions. Gently reminding government and any federally funded programs of the legal basis for language accessibility. That's Executive Order 13166, Title VI of the Civil Rights Act of 1964, and a provision 1557 of the Affordable Care Act. These are the main legal precedents, and the verbiage can be found online and printed and shared in any proposals that you want to put out there. Citing them as important, I think, definitely helps. And then, you know, trying to focus on strengths and assets. So just like I talked about at the beginning of this webinar, you know, we're all trying our best. We're all worried we're going to do it wrong. And I think that as people, we have a real tendency to blame ourselves when things are going wrong, versus praising ourselves when we're doing something well or versus when we're trying our hardest. So I think it's important when you talk to people about this stuff to recognize the progress that they have made with language access as opposed to kind of pointing out their shortcomings, right? So rather than going into, like I used to do, hospitals and saying, you guys need to provide interpreters, this is wrong, etc. I go into the hospitals now and I say, you know, this is new for all of us. We're learning together. How can we make it better? And this, you'll find, I think, makes people much less defensive and much more willing to talk about how to make it happen. Be prepared to help people understand why language access is so important and what it feels like not to have a voice in your community. And then simply following up, right? It's going to take a long time to get people who don't know anything about language access on board. So follow up, right? You know, say, hey, wondering if you got my email last week. We really need to get this information out. You know, do you think you have any spare funding you can give us? Or do you have any work that I can do to help you make this happen, right? Just touching in once in a while to make sure that it doesn't, you know, fall off of people's radars can really be helpful. So that's it. I wrapped up. We've got about 1 minute left in my portion of the slides. So thank you all for bearing with me. And remember that we are going to be addressing questions at the end. But for now, we're going to go ahead and next slide, please. Oh, you know what? I forgot about the last slide. I am so sorry. These are just some more helpful tips. I talked about a little bit earlier using different mediums that take literacy gaps into consideration, right? Visual aids are your friend. Anytime you can do pictures of people hand washing with soap, little videos, even if they're TikTok videos or, you know, Facebook stories or something on Instagram, texting people using robocalls, that stuff is all going to go a really long way in communities where literacy is a challenge. Designating leaders within English learning communities, you know, we talked about that in terms of identifying religious leaders and activists, and then trying to identify whatever rumors are going through communities and think of ways to dispel those. So I read somewhere that infodemics are their own epidemics, and that is especially true during a pandemic. So keep your eyes and ears to the ground in terms of trying to quell misinformation with real information using some of the things we discussed today. So thank you so much. And then if we can do the next slide again. I'm going to go ahead and introduce to you Julia Trujillo. She is the director of the Office of Economic Opportunity with the City of Portland, Maine. And then Erica DeLeon, who, next slide, is the director of One Siouxland in Sioux City, Iowa, as well as Fatima Said, executive director of Project Fine in Winona, Minnesota, and Katie, excuse me, Katie Van Eijl, program manager at Project Fine, also in Winona, Minnesota. And we're going to all put on our videos now so that you can see us while we answer some questions about language accessibility, both through sort of in the context of the work that we do, but also based upon some of the questions that you all sent during registration. So if you guys just want to go ahead and give brief introductions of yourselves and tell us about your organization. Let's go ahead and start with Julia.
Hello, everyone. My name is Julia Trujillo, and I am the director of the Office of Economic Opportunity within the City of Portland. So I work for local government, and I think that's the perspective that I bring today. Our normal role at the Office of Economic Opportunity is to serve our immigrant and refugee populations as well as our racial minorities in our city. And we do this not through direct service delivery, but we are kind of a clearinghouse and a coordinator of services across our city to improve the lives of the population that I already mentioned. In this crisis, We've also taken a more significant role in both the translation of documentation and the accessibility of the population to key resources to meet basic needs. So that has been our role so far.
Thank you so much. Erica.
Good afternoon, everyone. I'm Erica DeLeon. I'm the director of One Siouxland in the tri-state Iowa, Nebraska, South Dakota region. And One Siouxland is not a governmental entity. We're actually an initiative that was created with the support of our local governments and chambers of commerce and newcomer leaders to try to help connect all of those various resources. There's a lot of challenges in a tri-state community with different entities, different missions, different priorities. And so part of what I do is pulling a lot of that together. And so it's less direct service and more about connecting all the direct services to each other and to resources. So this has been an interesting time for all of us as we try to include language access and helping to be sure all of our newcomer populations are understanding the, I think you said earlier, Mary Jane, not like a dripping faucet, but a fire hose of information coming at people. So trying to help people sift through that in a way and in a language that they understand. So.
Thank you. Fatima and Katie.
Okay, well, I'm Fatima Said, and I'm Executive Director of Project Find. Project Find is located in Winona, Minnesota, and we are one of direct service providers. So we serve every year 2,600 individuals with different programs and educational services for refugee and immigrants to find and build better life. With this crisis, of course, our operation needed to change, and our delivering services and language services needed to change drastically. So Katie will talk a little bit about that, but we appreciate your presentation. It was very well done. And certainly for service providers that are in direct work with refugee and immigrants now, those times are very tough and hard to find the right information to share and find the way. So I'm very happy that we are talking about this and happy to answer questions, what we have been doing.
Great, thank you guys so much. And to give you all an idea how this next section is going to be structured, we're going to spend about 30 minutes now where I'm just going to be asking some guided questions to the four of our other presenters so that they can talk about what they're doing with regard to language access during this crisis. And I think it's really great that this is from the perspective of somebody who represents government, a group that represents direct service, and also an advocacy sort of backbone group that works in the community. So different perspective, same goal, and I'm really happy to have everybody together today. So Julia, I think we'll start with you. You know, government is sort of where I think a lot of people are looking for support right now. So can you talk about, you know, from a government advocacy perspective, what have you done proactively to work on language access, and also what has been reactive as this crisis unfolds?
Sure. And so I think that the first distinction, obviously, is that we are local government, so we are not at the state level, and the availability of information and also the information being shared for the most part is coming from the state level, but there's some key information stemming from local government. So our local government, it was okay doing language access, but we were not in full force until this crisis kind of came about. It's been a lot of education internally, going to what you were saying at the beginning. I think just having the key piece of information on what are the most spoken languages in the city, who are the key community partners that can support us in expanding the message, and how can we go about translation. So I think as you mentioned earlier, we obviously issue a lot of press releases, and from the Office of Economic Opportunity, our stand is that we want our limited English proficient population to have access to the same information as every other person in our city. So while we don't always translate the full press release, If we create, say, a basic fact document to try to get to the most important pieces of that press release, we make sure we have it both in English and other languages as well. So we're also not putting our limited English proficient population in a situation where they get the basic facts and everybody else gets the full document and the full information. So you also, I think from an equity perspective, you have to be mindful about those pieces as well. We have used a lot of graphic design and visuals to be able to share an important message such as stay home. And we've translated in multiple languages, also including English. Like I said, we're also highly dependent on state government. So we've been working very closely with state government to not only point out, again, the deficiencies or the risk factors of all the information that's going out in English and not any other language, but also every time we point out a risk, we come with 3 or 4 different solutions where we can support them from the local level and from our community partners' perspective. Because in Maine specifically, we have a brand new administration that just came into place. So they barely know how to figure out their own procedures. They've only been in place for about 3 months. So managing translation services, interpretation services, how to go about plain language, it's just a big challenge for them. So for those of us who've been doing this work for longer, I think it's helped them a great deal to have that helping hand and has avoided that corner moment, that defensive moment that you were mentioning earlier. I think also from a governmental perspective, I feel it's our responsibility to translate the messages. I don't think, even though community partners can customize or tailor the message in a way that their own communities and sub-communities can understand it, we have an obligation to translate what we are putting out to the communities. And I know that not every government entity feels that way. We have our great Google Translate button. But it has been an educational piece for us internally to local government as well, that is just not sufficient for people to be able to access those messages. So that's what we have done proactively. And it's not a perfect process. Also, I think something that we've been doing to try to educate our folks internally is not only the translation itself, but the process that it takes to translate things. That if for example, a press release is due to come out in this afternoon at 5 o'clock, for our team, it would be great if we knew that press release was coming out in 3 or 4 hours to buy us time. Rather than being reactive after the press release is released. So it is not a perfect system, but we are trying to work both internally and with external partners to be as instantaneous as we can with the information and offer our residents as much access to the information as we possibly can.
Great, thank you very much. And I think that kind of dovetails nicely with, if Fatima and Katie, can you guys talk a little bit about how the needs of your clients have changed since COVID-19 and like what kinds of strategies you've employed from the direct service perspective have been to sort of adapt to those changing needs, and what has been most successful for you?
Sure. So we provide interpreting services. We have, as I'm sure any of you others who work with interpreting have had a marked decrease in our requests since the beginning of COVID-19 due to the fact that our local clinic is trying to keep healthy people out of the clinic and delaying their appointments. All our dental offices and things are shut down here in Minnesota. So we have seen quite a decline in that and have been working closely with providers for things like virtual or phone interpretation, which has a whole host of other issues. The majority of the clients that we work with have really limited experience with technology, and so arranging virtual visits has been a challenge. The few families that we have gotten to work for, it works really well, and it's a good option. But we see part of our role too is that constant communication between the provider and the patient, that letting the providers know too that it's not people are refusing to do online. They just don't know how, or they don't have a computer, or they don't have the access. In addition to our formal interpreting and language services, but we have what we call advocacy and information referrals, which is a very long program name to describe kind of one of our really most important roles here in our community, which is being like a connector, connecting refugee and immigrant populations with existing community resources and with providers to make sure, kind of like Julia was talking about, to ensure that there's equity of access to information and that people can access what they need. Most of it's related to basic needs, and that, as you can imagine, with a decrease in interpreting services, our advocacy and information services have gone through the roof since the COVID-19 pandemic has started. We are averaging, each of our staff has our staff collectively, we're probably averaging 70 to 100 calls a day for those services, and those are for many, many different things, from unemployment to information about the virus, to our stay-at-home order here in Minnesota, to and sometimes in Wisconsin, because we actually are we're in a border community as well, helping kids connect with school for virtual learning, just pretty much anything you can think of that your family has been dealing with, plus everything else. And for those of us who have the language skills, it's a challenge enough to find accurate information and access those resources, but that's where Project Find plays such an important role, that we're helping people who don't have the language piece. And one thing we've seen right now is that's really beautiful, and I'm sure people are seeing across the country, is that a lot of the resources are community members coming together and doing kind of grassroots response, which is so beautiful and it's amazing. But those things, one challenge for people that we work with limited language skills is that those are sometimes harder to access, because the folks organizing those services don't work within a government system or within a particular like a human services system or a health system. They don't always have the infrastructure in place. So that's where we see our role as extremely important, sharing and disseminating that information. I see a question here in the chat box, which I guess I will answer quick, about assisting people who have low tech capabilities. I mentioned phone calls, 95, 99, whatever, almost all of the work that we do is over the phone. So all of our staff are working from home right now, and they are receiving calls from individuals and calling people that we work with all the time. I think that's one of the things that's on this panel, at least, is a little different for us, is that we are a direct service provider. So for your direct service providers, a lot of times you already have those existing relationships. You have phone numbers. You are known as a trusted source that people come directly to. So we've been doing that, and we also have used somewhat our Facebook. We have a Hmong Facebook site, Spanish language Facebook site, and organizational Facebook site. Those are the largest languages in our community, where we share information, and we've been working really hard to vet that information through our Minnesota Department of Health or the Center for Disease Control, that the information is accurate. It doesn't take long for the governor to come on with a press release or with a press conference about something, and within 10 minutes, people are, not even 10 minutes, people are calling our staff saying, what does this mean? I heard I can't go outside. I heard this is this. So working to be timely and to use tools that we have. Coming into a Zoom call like this is a challenge, but a lot of people do have Facebook and social media. So we're trying to work through that.
Yeah, and I wanted to kind of pivot that to Erica, to ask about what your communication strategies have been. Like, how are you reaching English learners, and how are you disseminating information to them?
Well, the first thing I'll talk about is some of the tools that our local partners have been using and why they've picked the ones they have, but then I'll tell you about a strategy that we've implemented that will get to some of the low-tech users in the community. But we did a little bit of a survey just of local partners to see what sort of capabilities they were using, and Zoom seems to by far and away be the largest. And if you're watching any kind of news, everyone's talking about Zoom right now. apparently you do need to use the password option because there is a lot of security concern with that. And my kids have had multiple calls with teachers canceled because they suddenly get concerned with the security. So be sure if you set it up that you're using a password. I did learn from some of our healthcare partners that Zoom has a health option that's HIPAA compliant, and our local healthcare providers are also using Doxy, and both of those, again, are HIPAA compliant. So if that's a concern with your organization, they've been really happy with the services they have there. Some of our healthcare providers, even mental health therapists, are doing everything virtually. Even if a client is in the office, they put them in a different room than where the therapist is, and they're still, and that's one way to, I guess, get around some of the low-tech capabilities, is they'll have their clients go ahead and come in like they normally would, just put them in a different room than where the therapist is. And then there's an iPad in each room and everybody jumps on and they're still able to get their service. So that's helped with some of the low-tech capabilities. And the buses, that might change a little bit. The buses have stopped running and a lot of their patients were getting to them that way. So they're looking for other routes as well. FaceTime, of course, continues to be popular. FaceTime and WhatsApp have been popular among our newcomer communities for years and years. So they're continuing to use those resources. What's been great with our local immigration legal service providers is we just got a grant for from Partnership for New Americans through Cities for Citizenship in this community this year. And so some of our partners had started to use some of the Citizenship Works materials, especially the educational part of that. And now in the last few weeks, they've really started to look at using it as a legal option as well for the legal services that are associated with naturalization. And if you've not used it before, as an actual provider, so as an attorney or as a DOJ rep, you can have your own portal on Citizenship Works so that a client can start their application, and once it gets to a certain point, it'll come to the attorney or the DOJ rep to review, and then you can do a virtual call, either just audio or audio and visual, which is fantastic. A lot of providers will have their clients hold the green card up to the screen so they can verify everything's okay with it and look at other documents that way. But some of our local providers are starting to lean on those sorts of tools, and then also doing a lot of FaceTime calls with their clients and not having people coming into the office. So those have been handy, but we have a good example of what not to do. In the very early days, we have a really large Somali population in our community. And so in the very early days, they really wanted to get on a call with some of the trusted folks in the community to just ask questions and make sure they had all the right information to disseminate out to the rest of their population. So one of our local mayors and an ER doc and our immigration attorney and myself were on a call with them. And we thought it was just going to be the elders of the community and one interpreter, which, you know, still is 8 or so people on a call. But I'm pretty sure that they passed out the conference call line to anybody in the community who wanted to join. We had more questions coming in multiple languages, and having to then, no one was really designated the moderator from the beginning. So nobody was actually stopping to make sure the interpreter had time to interpret and so on. So the topic was very strictly just limited to the coronavirus and what specifically they were supposed to do and not do right now. We didn't get to any other topics, but they got their questions answered. But we decided from there that we definitely needed to look into either the simultaneous interpreting with Zoom or disseminating information just through some of the elders that then would reach out to the community, so that there wasn't the translation part going on when there was no visual. I think that was a real challenge, because at least with visual, you can get clues from a person who's leading the meeting that maybe you need to pause and let the interpreter interpret. And simultaneous can't happen in the scenario we were using. So that was a good lesson in what not to do and how to get information out a little bit better. And one thing that sort of led us to do was talk to some of our language service providers in the community about better ways to get information out to everybody. There was just so much information in March coming out that even native English speakers and native born Americans were struggling, and we all still are. We are still struggling with understanding what exactly we're supposed to do, especially when you live in a tri-state community and you now have 3 health departments and 3 governors and the federal government and multiple cities, and the rules are a little bit different everywhere. Our tri-state community, though, is these 3 states are 3 of the last in the country that don't have statewide stay-at-home orders. So that's one thing that's consistent, is you can still live and work in the 3 states and not get a ticket for being out if you're in one of the states. So that's kind of unusual compared to the rest of the nation. But everybody knows somebody somewhere else and is still getting information. So we wanted to make sure that was disseminated. And we're not like how in Maine and in Portland where Julia can just sort of coordinate some of that and send it out. We again have 3 states and multiple governments. So we're really trying to find that one channel. Do you want me to talk about the podcast now? Because that would.
Yeah, why don't you talk about the podcast just very briefly, and then I think Julia had some non-digital resources, and it feels like a good time to have her share those.
Okay, well, and the podcasts were just a way to take information that was coming from all of these sources and gathered into one space. It's being translated into now 4 languages, and we have 2 more that they're working on that hit the key areas. And then every day those podcasts are disseminated out into communities. So it's our local public media. It's called Siouxland Public Media if you want to look them up on Facebook or the internet. And they will write the news in English and then email it to the designated interpreters who then record it in their homes, email it back for production, and then it gets posted later that day. So the challenge then is how do we make sure that podcast for Somali, for example, gets to all the Somali people in the community every day? And we're getting there. It's kind of a slow process, but I think they're about 4 weeks in. And so we're hoping to get some analytics now and see how many people have been clicking through and how that's been increasing. And then we've been working on disseminating that through some of our larger employers and having them within their cafeterias and places where they've got information already being disseminated to get that daily information popped onto those screens so that people can see and hear it every day.
That's a really awesome example of disseminating information through employers. I know in Southwestern Pennsylvania, we have a lot of tech and a lot of healthcare, and having them share information with their staff has been really valuable for us too. But Julia had mentioned at one point that she has some non-digital resources, and I think it would be valuable to share those here too.
Sure. So I think what I shared at the beginning is that we are now playing this kind of added role of being that translation kind of hub internally to local government. But our true nature as an office is to connect people to the resources that exist. So it quickly became a reality and a concern that this crisis was not just about health and public health, but also accessing basic needs. So food security, access to school information. So we quickly started thinking about how can we help the community access these key resources. And we quickly developed both a website, a clearinghouse with COVID-19 resources, but we also realized, of course, that there were a lot of communities that do not have access to digital materials. So we came up with our first resource guide that was a 1-pager with what we thought was the basic information that people needed on, say, week 2 or 3, I can't remember now, with food, school, access to information on unemployment, etc. And we printed it in the 6 most spoken languages in the city. And we partnered with our food security partners that were distributing food across our city with different community partners. So we have the central hub that creates the food boxes, and then the schools come and pick them up. The refugee resettlement agencies come and pick them up from that central hub. And we distributed this one-page resource guides across the city. And it was so successful that they asked us for another set the following 2 weeks, and we did it again. And now we're creating a resource guide 2.0 that really points out people to, as Katie was pointing out, mostly telephone numbers, a really concrete resource for someone that is in crisis or needs some basic food or needs to contact somebody about school. And something that we have done in those resource guides is that we are testing every single phone number, every single resource that is in there to make sure that we are not pushing our limited English proficient population into a resource that just happens to be all in English and not helpful at all. So that's another due diligence that I recommend everyone to do because it's pretty common.
Thank you so much for sharing that. I had another important question I wanted to ask you, Julia, and if you can keep it somewhat brief so we have a chance to hear from everyone else again. Can you talk about what you have done specifically to advocate within your government agency to people who might not understand how important language access is? You know, I know some governments are just all on board and others are not, and yours may be the former, but what kind of advocacy efforts with regard to language access during this crisis have you found successful?
Well, I think internally to local government, our strategy has been to kind of outline the risks with always showcasing a solution and how we can come in and we can provide a series of translation services, or if it's not feasible, to send us a press release 2 hours before it's supposed to go out. And we can't translate it instantaneously, at least we can put some basic facts. And we could quickly learn that also what you mentioned earlier, Katie, and I think Mary, about just the importance of making sure that it's actually accessible. So something that we've never used in the past has been Google Translate, for example. I've been working with these communities for 10 years plus, and it was now in this crisis that I try to test it and see how effective it was in my own language. And because I do not speak any other language besides Spanish, I had other tests, different texts and content. And what we're doing now in order to make sure that people receive the information as soon as possible is that not always, but sometimes with key messages, we do use Google Translate, and then we send that message to a native speaker that proofreads it, and then that's what we send out. And that has proven to be quite helpful.
Thank you so much. Fatima, can you share with me, given that you work with such a variety of service providers, healthcare providers, etc., what kind of creative strategies can you recommend or have you seen from them during this time?
Absolutely. As you know, we are the only one in services, and we work with service providers all the time, building that relationship of understanding. But what we really right now find out that we need from our service providers is patience, because many of clients that we work with and that they serve really don't have understanding of now being having those appointments by technology. They don't have access like Katie was talking about. We really are trying to help our providers to be able to deliver message to our clients, asking for patience and flexibility, because it's really important to be flexible during this time when we now trying to, first of all, to educate our refugee and immigrants about crisis that we are in, making sure that they have an accurate information. So help from other service providers that we are bridging between refugee and immigrants is very important, very needed. Most of the time for us, patience, flexibility, and being able to really meet our clients where they are. We do have a wonderful relationship in our region with service providers, and we're able to really navigate all these needs between service providers as well as our clients, and it's working well. But I also wanted to mention something, that how important this what we're talking about today is. Language access is so important that we should be talking all the time, not just when we have a crisis. We had a crisis several years ago in our region with a fire and flooding, and same things happened. Refugees and immigrants were left behind because of urgency and everything that's going on. So finding the ways to really work on this language access to all is very important during the crisis and before and after the crisis. So I'm really glad that we are talking, we are learning from each other, but in our interaction with service providers, flexibility, patience for people that really don't understand what's going on have been the key to be able to go through the epidemic and serve our refugee and immigrants and keep them calm and not to miss anything important. Katie, would you add anything else?
No, I think being inflexible, and it just reminds me, I just thought of an example as Fatima was talking, you know, how important it is to work with direct service providers in the community. I guess that's my plug for people, for organizations like ours that work directly with communities or have interpreter services. Just a half hour before we started this webinar, I got a call from our local clinic, or actually I got a call from a gentleman who spoke English but had a heavy accent, and he said, oh, I tried to make an appointment at the clinic and they told me just call you. And I said, okay, do you need an interpreter? And he was like, no, I speak English. I'm like, okay. I'm not sure why they sent you here, but I can certainly help you, you know. So I did make a call to the clinic and got some information for him and called him back. But those are the little things that I appreciate the provider sending them to us thinking, oh, maybe this is a limited English speaking person. But I think that it's in this time where everybody's needs are so high that for all of us to be patient and to do as much as we can and to help out whoever we can. That's not someone who will be using our language service, but it's still important for us to do everything we can to help our community.
And I will just add to Katie's what she says, you know, that relationship with our service providers is very important to us, that we really have a great relationship. We also have 24/7 language line for our service providers that can contact us any time of day or night. So now our clients also contacting us because of this uncertainty and fear that people experiencing, you know, this 24/7 line has been really beneficial, and we try to answer every call. But relationship with service providers and organizations that provide direct service to refugees and immigrants is really the key.
Thank you both. We have time for just one more question that I'm going to direct to Erica right now. And then after that, we're going to move into the Q&A portion, which I'm really excited about. So, Erica, given that you work with so many different coalitions as an advocacy and kind of what we call a backbone organization, how have you advocated for language accessibility across all of your coalitions, and what has been successful versus not really much of a return on your time investment?
That's a trick question. I should find out who's on this call first before I answer that, right? No, I'm just kidding. Actually, one of the projects that as a coalition we've been working on for about 3 years now is developing what we sort of call a language bank, or a 24/7 type of resource. As they were just saying, in Minnesota, they're able to access interpreters now 24/7. And there's so many limitations in our community to be able to do that, it means that healthcare providers and the police particularly can't rely on a local organization 24/7. And so they use the various tools that they have discovered over the years that, you know, cost $4 a minute to be able to use interpreting all the time and have it be reliable. Now, of course, both of those types of organizations both have internal interpreters as well that they use as much as they can. But for a lot of the less common languages, or for middle of the night interpreting, they do have to rely on somebody that's a phone call away or something. So we've really tried to work with local organizations in developing something where there could be that 24/7 access, even if it's a local person that they have to wake up at 2 in the morning, but at least it's a local person who could be there in person if needed. And there's just a lot of challenges to getting to that point. But what we found, at least during normal hours, is that if we work with our organizations that are most exposed to various cultures and various languages, they are typically responding themselves. I mentioned earlier how these podcasts are being distributed through some of our larger employers. And we're really lucky to have a Tyson Foods in our community who, not only do they have one of their corporate offices here, but they also have a plant, and it's one of their largest plants in the country. And so we have really good connections with the corporate and the plant employees and officers, and have been able to make a lot of progress as far as language access throughout the community, because they're so willing to share their interpreters in various ways. And there have been times when I've been asked if I can get an interpreter in a particular language. And if I don't know somebody, the first place I call is actually Tyson, because they typically will have somebody. And it's funny because the last couple of times they've said, no, we don't actually have somebody in that language. And within a week they've called and said, oh yeah, now we have enough employees that we have an interpreter in that language, and here's their information in case you need to use them. So they've been a great partner. The school districts as well, because they are first to respond if they've got a student who needs a different language. So they're always quick to help us. But those have been the best ways. Unfortunately, we do, because in a tri-state area, we have so many different local governments, and the size of them are so different that some of the smaller ones just don't have the capacity to do any more than the Google Translate button. And so it hasn't necessarily been local government led. Unfortunately, it's been more from the perspective of employers and the school districts. But that's where, you find where the momentum is and you go with it. And every community is going to be a little bit different with where those strengths lie. And in our community, it just happens to be more with the school districts and our larger employers. So we harness that and do our best to find ways to develop language access for the entire community. And we're fortunate that they are willing to share as much as they can to be able to increase that. So
yeah, that's great. And this feels like a great time to pivot to the Q&A. Melissa, I'm going to turn it over to you.
Great. Thank you all so much for your really great discussion, sharing the resources and the ideas and the ways that you've been able to really ensure that there's communication, language access, and equity in all of this information as it's being disseminated out into the local community. So really appreciate that. So everyone has access to the chat feature in your Zoom. We'd really love to hear questions from you all. So please feel free to go ahead and send those to the panelists, or you can send them to everyone, and we'll try to make sure as many questions are answered as possible. We have gotten a couple of questions in already. One of them comes from Sal in St. Louis, Missouri. I'm going to kind of summarize this one here. But really, so he's recognizing the fact that unfortunately too often the responsibility to translate and interpret becomes the responsibility of communities with the least amount of resources. And so how do we encourage public health and public safety to fund and institutionalize interpreting and translation services? I think this kind of gets to your point, Fatima, that everyone's responding right now to language access immediately in response to the crisis. And so how do we make sure that this is something that's institutionalized? So leave that one up there for you guys, whoever wants to respond. And I'll keep.
I guess I will share example what we and how we have been developing relationship with our local government and other service providers. We actually are located in our county building, and we do have a contract with county for providing advocacy and information for our clients. That is one contract. The second contract is providing language services, interpreting and translation for population that we serve. So that was very helpful for this to happen. It took a lot of relationship building and making sure that we document and that we were able to provide information with what we were asking of our local government, the need that what we are doing is something that their staff cannot, kind of helping, being really a bridge, like Katie was talking, being a bridge between service providers and refugee and immigrants. So for us to be able to provide advocacy and information right now, it's really helpful because we do have a funding to do that. Yes, now our need exceeded the funding that we have, but we don't mind because this is what our clients need right now. Language services, our program language services always has been there. We always had a contract with many, many providers in our community. So we are only one that they hiring, and that's why we make sure that we are 24/7 available. We have 23 different languages that we cover. We try to have all languages of the people that live in our community. But again, I cannot stress enough how important is building relationship with local government, educational institution, community at large, service providers, to really understand that we need each other and that this is kind of a mutual need, but also mutual benefits for entire communities. So that's how we have been doing advocacy as well as interpreting, because no matter what you're doing, you need resources, you need the funding. So that was our way to be able to do this.
Thanks, Fatima. And I'm just going to highlight a couple of things there, right? The first one is that what you were talking about with the contract, having that in place, and I'm just going to do a little plug here. So we are going to be working with Global Wordsmiths, as I mentioned at the beginning of the webinar, for both a language access toolkit. So thinking about how do you create a language access plan within your local government or within your local organization, and making sure that you have things like those contracts and services and trainings in place. So we're working on that. And then we're also doing some coaching as well through Global Wordsmiths, through Mary Jayne, the presenter today, so that you all can also kind of dive deeper on some of those aspects as well. Related, the contract is what brought that up. And then I also really appreciate what you said, Fatima, about the mutual benefit, right? Of really continuing to recognize that this is something that we're working together on and that it's not one. Did anyone else want to add something to that before I go on to the next question? Mary Jayne?
Yeah, I just, I'm looking at Brittany's question here.
Oh, okay,
Yeah, me too.
And I'm thinking about how relevant it is, but how also, at the moment, for me, and this might be different for everybody, I think that now is the time to show how important language access is, right? Now is the time to make it happen. Now is the time to make sure people have the information they need. And, when this is all over and when the dust settles, then it's time to have real conversations about this, right, with government providers, and to say, we need to be proactive about this and not reactive next time something like this happens, right? You need a language access plan. You need to figure out how to communicate with people in emergency situations. So that's kind of my go-to that I was hoping to share with everybody, is that it's really unfortunate that it takes a tragedy of this magnitude to get people to do the right thing. But I think as much as we can advance that narrative, it's very important.
If I can just add just quickly in a non-crisis mode, I used to run the Office of Multicultural Affairs statewide during a time with kind of a very conservative administration who immigrants were not at the forefront. And what worked for me at the time was to educate our legal counsel internally to our department on Title VI. And I had two attorneys that helped put the risk forward for the rest of the decision makers. And it took us a couple of years, but in a couple of years we had a language access plan, and they hired a civil rights Title VI full-time person to support our work in the Office of Multicultural Affairs. So I think highlighting the risks associated with Title VI sometimes can also help our cause.
Great, thank you both. So I'm going to go to one of the questions that we received in advance of the webinar. And I know that this one is a lot, so we might not have time to really dig into it, but I think it's a really important one, particularly as people are kind of thinking about redeploying employees, particularly in this time. And so are there any standards or protocols, or do you either have, does anyone here have experience with thinking about how to use employees, and I think particularly government employees, with language skills to support COVID-19 response?
I think from a government perspective, our experience in normal times, we have a bank of multilingual employees, but we have not used them just simply because our employees are experiencing a lot of stress as well in different situations at home. So we've we've actually been partnering more so with our natural helpers. So our office has a natural helpers cohort that represents 12 different countries. And we meet on a weekly basis, and they're embedded in the community and they're motivated. Last week, they decided to do videos in their own languages, telling folks about the stay-at-home order and other things. So we have not used that bank, but I don't know if others have.
Then another question for you all is, how do we make sure that underrepresented languages, so maybe not those top 5 that we're typically used to providing information in, but how do we make sure that these underrepresented languages are also having access to the vital information?
For me, that really goes along with the piece of not just saying broadly, oh, these are the big languages that are spoken in our city. This is where they generally live. So translate A, send to group, right? It's more about building relationships and relying on the relationships within those communities to build relationships with those leaders so that they can disseminate the information, because I think sometimes trust can be an issue, as well as not knowing the source of the information, and so not taking it seriously within a lot of these communities. And so talking to people who are from those communities and have the relationships and are trusted in those communities is a really important vehicle for that.
And to tag on to what Mary Jane said, the resources that have been coming out through Welcoming America and some of our other national partners are coming in so many different languages. Sometimes it's been really great to get access to a lot of that information because it is applicable to everyone. And then we've been able to share that with our trusted partners, whether it's the employers, the schools, or the nonprofits that are working directly with community members at daycares and things like that. Because even if I send them a document that's been translated into 40 languages, and I know for sure they need 5 of them, they might surprise me and realize that, or have a family come to them in one of the languages that we didn't realize we needed to translate something into, but because somebody in Cleveland or somewhere already translated it, we were able to share that information. So a lot of the information about COVID-19 is it's in different forms because it's coming from different sources, but it's getting in the languages that we need. So it's been really valuable to have that national network of different organizations, governmental, nonprofit, everybody who's sharing their resources. And much of that is coming through Welcoming America. So we're really appreciative to that, but the other partners that have been sharing information, and local governments and different health departments, and of course, we're trying to get most of it directly from the CDC, but it's not always all there. So it's great to have this fast network that you can share those resources. And we've been disseminating a lot of that to our community partners as well, just to make sure that if some language pops up, they know where they can go to get that language and get good information out to people.
Well, thank you so much. We really are about at our time for the day. So as you've mentioned, Erica, just now, about some of those resources that have come out, I do want to just highlight the post that Christina Pope, our network director, shared on the member forum today about some best practices and tools around interpretation and virtual meetings. So I know that was one of the questions that someone had in the pre-webinar registration form, and so I just want to highlight that. And then also Welcoming Michiana has compiled a Google Drive folder of a whole lot of different materials, and that's also on the member forum, and that's also something that continues to be recirculated. So we appreciate your efforts from there, from Lisa Stockberger. So Anthony, if you go to the next slide, please. So we have another webinar coming up next week on April 23rd. It'll be at the same time as today. And it's really focused on the topic of xenophobia and how to address hate and division during this time. So participants will walk through frameworks to help understand the intersections between health, economic, and hate and division, and learn tools for communication-based approaches to address these challenges and create more inclusive and resilient communities. A link to register will be included in the follow-up email, and it was also sent out in the same email that was for registration for today. So hope you will also sign up for that one. And if you have any questions about today's webinar or have a suggestion on a future webinar topic, please send an email to events@welcomingamerica.org. We really appreciate all of the information and resources that all of you have provided to us and to our members. We want to continue to build on all of that. So on behalf of all of our speakers today and everyone at Welcoming America, I'd like to thank you for your time, and we hope to see you on a future Welcoming America webinar. Have a great rest of your day.